Hi, in this presentation, we will be looking at the adrenal gland. So what do you know about it? Well, the adrenal gland is an endocrine organ that sits on the top of the kidneys. There are two layers, the outer and the inner layer. The outer layer, called the adrenal cortex, produces and secretes corticosteroids such as glucocorticoids, mineralocorticoids, and androgens. The second layer, or the inner layer, is called the adrenal medulla. This produces and secretes adrenaline and noradrenaline. This is also called the fight or flight response. In this presentation, a particular disorder of the adrenal gland will be focused. This disorder is called the Addison's disease. Addison's disease is an autoimmune disorder that causes damage to the adrenal cortex, or also known as the primary adrenal insufficiency. Abnormalities in the pituitary gland causes the adrenal gland to not produce enough cortisol, which is a steroid hormone in the glucocorticoids class of hormones. These abnormalities are also known as a secondary adrenal insufficiency. Once the adrenal gland is 90% damaged, there will not be enough hormones produced, especially cortisol and aldosterone, and symptoms of Addison's disease will manifest. Lee and Yu states that the immune system attacks the adrenal gland, so it no longer produces hormones, and if it is left untreated, it can be life-threatening. Cortisol helps the body respond to stress. It is also released to control blood pressure and cardiovascular function. It also helps to regulate water in the body and control blood sugar by balancing the effects of insulin. Aldosterone, on the other hand, affects the sodium and potassium electrolyte balance, as well as maintaining water levels, blood pressure, and blood volume. Here are some backgrounds on the types of symptoms in Addison's disease. We've got fatigue, which is mostly common, hyperpigmentation, which is mostly found near scars, skin creases and mucous membranes, variety of GI presentations including nausea, vomiting and abdominal pain, and diarrhea being less common, poor appetite and weight loss, vitiligo, hypertension or lightheadedness and fainting upon standing, syncope, irritability, depression and poor concentration, salt cravings, and irregular menstruation, loss of body hair, and decreased sex drive in women. So who is at risk? According to Lee and Yu, people at risk are those who have had cancer, those taking anticoagulants or blood thinners, those with chronic infections such as tuberculosis, those who have had surgery on their adrenal gland, and those who have a disease such as diabetes type 1 or Graves' disease. On assessment, patients with Addison's disease will present with acute adrenal failure or Addisonian crisis, sudden loss of strength, severe pain in lower back, abdomen or legs, vomiting, diarrhea, low blood pressure, loss of consciousness, life-threatening medical emergencies such as shock or kidney failure, and setting off when under stress, for example accident, trauma, or severe infection. Here are some recommendations for patients with Addison's disease. Blood test for low sodium and high potassium levels. Specialized adrenocorticotropic hormone or ACTH stimulation test to see if sufficient cortisol is produced in response to it. In addition, we also recommend to do an insulin-induced hypoglycemia test to see if it is caused by problems with the pituitary gland, or an X-ray or CT scan to see the size and detect signs of disease to the adrenal glands. According to Mayo Clinic, nurses should start hormone replacement therapy, use steroids, regular anti-sickness injections, intravenous or IV medication, IV fluid, and sodium and dextrose intravenous. Thank you for watching, and I hope you enjoyed this video.